Hello everyone and welcome back to my channel. In today's video, I'm going to talk about a common health problem that some pregnant women face: fetal problems. Fetal problems are any issues that affect the growth, development, or health of the baby in the womb. They can be caused by genetic factors, infections, or environmental exposures. The good news is that most fetal problems can be detected and treated before or after birth. Your doctor or midwife will perform various tests and scans during your pregnancy to check your baby's condition and progress. Some of the common tests and scans are: 1. Ultrasound. A painless procedure that uses sound waves to create images of your baby and your uterus. 1. It can measure your baby's size, position, movements, heartbeat, and anatomy. 1. It can also detect some birth defects, such as spina bifida, cleft lip, or heart problems. 2. Blood tests. A simple procedure that involves taking a sample of your blood and analyzing it for various markers or substances. 2. It can screen for some genetic disorders, such as Down syndrome, cystic fibrosis, or sickle cell disease. 2. It can also detect some infections, such as rubella, toxoplasmosis, or syphilis. 3. Amniocentesis. A more invasive procedure that involves inserting a thin needle through your abdomen and into your uterus to collect a sample of the amniotic fluid that surrounds your baby. 3. It can test for some genetic disorders, such as Down syndrome, cystic fibrosis, or sickle cell disease. 4. It can also test for some infections, such as rubella, toxoplasmosis, or syphilis. 4. Chorionic villus sampling, CVS. A more invasive procedure that involves inserting a thin tube or needle through your vagina or abdomen and into your placenta to collect a sample of the chorionic villi, which are tiny projections that form part of the placenta. 4. It can test for some genetic disorders, such as Down syndrome, cystic fibrosis, or sickle cell disease. These tests and scans are usually optional and have some risks and limitations. You should discuss with your doctor or midwife the benefits and drawbacks of each test and scan and decide which ones you want to have. If any of these tests or scans show that your baby has a problem, you will be referred to a specialist who will explain the diagnosis and the treatment options. Depending on the type and severity of the problem, the treatment may involve: 1. Medication. Some fetal problems can be treated with medication that you take orally or by injection. 1. For example, if your baby has an infection, you may be given antibiotics to clear it up. 1. If your baby has a heart problem, you may be given medication to regulate his or her heartbeat. 2. Surgery. Some fetal problems can be treated with surgery that is performed on your baby while he or she is still in the womb. 2. For example, if your baby has spina bifida, a condition where the spine does not close properly, a surgeon may close the opening in the spine to prevent further damage. 2. If your baby has a diaphragmatic hernia, a condition where the diaphragm does not form properly and allows the abdominal organs to move into the chest cavity, a surgeon may place a balloon in the trachea to prevent lung compression. 3. Delivery. Some fetal problems can only be treated after your baby is born. 3. For example, if your baby has a cleft lip or palate, a condition where the lip or roof of the mouth does not join together properly, a surgeon may repair it after birth. 3. If your baby has a heart defect that requires surgery, he or she may need to be delivered early and transferred to a neonatal intensive care unit, NICU, for immediate care. Fetal problems are a common and treatable condition during pregnancy. By following these tips and advice, you can detect and treat fetal problems and ensure a healthy pregnancy for you and your baby. I hope you found this video helpful and informative. If you did, please give it a thumbs up and subscribe to my channel for more pregnancy-related videos. Also, feel free to leave a comment below if you have any questions or suggestions for future topics. Thank you for watching and I'll see you in the next video. Bye.